Hi, my name is Elizabeth Bennett, and today I'm going to be talking to you about thrush. So what are we going to learn about thrush? We're going to learn about the causative agent and some common causes or risk factors. We're going to learn about the signs and symptoms, as well as diagnostic testing and what treatments are available if you or someone you know has thrush. All right, so what is thrush? Thrush is also known as oral candidiasis. It is a type of fungal infection that is caused by an overgrowth of yeast of the genus Candida. Candida are a part of your normal microflora that live in or on your body, such as in your gut or in your mouth. And the most common causative agent of thrush is Candida albicans. Thrush is typically uncommon in those with a healthy immune system. It is known as an opportunistic infection. So when the number of Candida in the body is low, it is typically harmless. But when the immune system is weakened or there's less competition from the good bacteria, Candida is able to flourish and take over. A weakened immune system, whether it be locally or systemically, puts you at an increased risk for thrush. The CDC reports that 1/3 of patients with advanced HIV have candidiasis in the mouth. Certain medications put you at risk of developing thrush. Antibiotics work to get rid of the bad bacteria in your body, but they also get rid of the good bacteria, including in the mouth. Without the good bacteria, the Candida yeast can flourish and take over. Corticosteroids also weaken the immune system locally when taken in the inhaler form. Having diabetes puts you at an increased risk for thrush because of the high sugar levels in your saliva, the lowered resistance to infection, and dry mouth, which can all promote the growth of Candida. Dentures without adequate cleaning can also increase your risk for developing thrush. And then in newborns, a vaginal birth by a mother who has an active yeast infection is able to colonize the baby as they pass through the birth canal. Here we're going to look at the pathophysiology of thrush. So you start with Candida present in the mouth. This doesn't mean that you have thrush just because it's present. It's when the immune system is weakened or the flora is disrupted that the Candida can overgrow. This causes a destruction of the stratified squamous epithelial layer, which leads to an accumulation of the destroyed cells and keratin protein. This causes a pseudomembrane to form, and this sticks to the mucosa in the mouth, giving a whitish appearance, which you'll see on the next slide. So the main symptom of oral thrush are these thick white patches on the tongue or in the mouth. Here you can see that they have like a cottage cheese appearance on the roof of the mouth, and here you can see it on the tongue. This picture shows where the Candida overgrowth has occurred where the dentures were. Typically, these white patches, if they are rubbed, they may bleed, but they typically won't come off. Thrush may also be present on other parts of the mouth, not just the tongue. It's present on the cheeks, the roof of the mouth, or the throat as well. And here you can see it on the uvula, which looks very uncomfortable. While the main symptom of thrush is typically those white patches in the mouth, they may also show some other signs or symptoms. These could be redness or soreness in the mouth, a cotton-like feel in the mouth, pain when eating or swallowing, loss of taste, which we now associate with just COVID, but it is also possible with thrush. Cracking or redness in the corners of the mouth, or in infants, you may see poor feeding or fussiness. So here we have a picture from Heather Jones from Very Well Health, showing the different conditions that are mistaken sometimes for oral thrush. A big one, I believe, is the milk tongue. That's because thrush is common in newborns, and the milk tongue they can get sometimes with eating. But the difference that you can associate between thrush and milk tongue is that a warm washcloth will typically wipe away milk tongue, while thrush will not go away. Milk tongue is also seen only on the tongue and after feedings, and oral thrush will typically be present all the time. Diagnostic testing is relatively simple. It's usually just a visual inspection of the mouth to diagnose thrush. But if needed, the small scrapings of the white lesions on the mouth can be taken and viewed under the microscope to see and identify Candida albicans, which here we have a picture of Candida albicans. You can see the pseudohyphae here. There's a couple antifungal medications that are used for the treatment of oral thrush, according to the CDC. There's nystatin, clotrimazole, miconazole, and fluconazole. Fluconazole is typically reserved for the more severe cases. Miconazole comes in an oral gel form. Clotrimazole is a lozenge, so it shouldn't be given to children younger than 5. And nystatin is in a liquid form. According to the authors of Pharmacology, a patient-centered nursing approach, nystatin is a fungostatic and a fungicidal. So it not only kills the fungus, but it also inhibits the growth. It does this by binding to the ergosterol, causing a loss of intracellular potassium and other cell contents. The azoles, such as fluconazole, miconazole, and clotrimazole, are fungostatics. So they increase permeability of the fungal cell membrane and inhibit ergosterol synthesis. Another treatment is an over-the-counter antifungal, and this is gentian violet. It will cause this purple color to the baby's mouth, though, if you do give it. Typically, the treatment for thrush lasts about 7 to 14 days, and it should resolve in about 2 weeks as long as your immune system isn't compromised. These are the steps for giving nystatin to an infant or a child. So you're going to drop half of the medication in one side of the cheek and then half in the other. You're going to use a cotton tip swab and paint the medicine onto the tongue and gums of the child. If you're giving it to a child that's older or an adult, the medicine can be swished in the mouth for 30 seconds before spitting out or swallowing, whichever your physician recommends. And then you should wait 30 minutes before eating or drinking. If you wear dentures, then you may need to soak them nightly to eliminate the fungus from the dentures as well. Some tips on preventing thrush include rinsing your mouth out with water after using a corticosteroid inhaler to help rinse some of that residue that gets left behind in your mouth. Properly cleaning your dentures and ensuring that they fit properly can also help prevent thrush. Practicing good oral hygiene is also important. And if you're going to be on a long course of antibiotics, you can take probiotics to help increase that good bacteria back into your body. So what did we learn today? We learned that thrush is a fungal infection caused by an overgrowth of Candida albicans. The risk factors include a weakened immune system, certain medications, diabetes, dentures, and for the newborn, it could just be birth. The signs and symptoms include the main symptom of white patches in the mouth, cheeks, or throat, or even on the uvula. But they can also include a loss of taste, a cracking in the corners of the mouth, or redness and pain in the mouth. The diagnostic testing is typically a visual inspection, and treatment includes those azole antifungals, such as fluconazole, clotrimazole, and miconazole, as well as nystatin. The ways for preventing thrush include good oral hygiene. Oral thrush should be treated as soon as possible to help contain the infection. So if you or someone you know has white patches in your mouth that you just can't seem to wipe off, please see your physician. Thank you.